Okay.
Good afternoon. Welcome in IMS. Today is an important day for all dental profession. Today is the Gum Healthy Day, and IMS intend to participate to this day with the support of a research department, Professor Ashank Mishra, and one of our lecturers, Professor Francesco Romano. They are the academic board member of IMS, and today we are here to present our activities and how we intend to propose our activity with a student. We trust in a new format of learning, and in this format of learning, we trust in the activity that a clinician can do with a student. So I leave the word to Professor Mishra that will explain us the Gum Healthy Day and the rule of IMS.
Hello, everyone. Good evening. This is Professor Mishra from IMS Research Department. Thank you, Professor Mascolo, for giving us the opportunity for this platform. And me and Professor Romanos are very privileged that today on Gum Health Day, we are for you all. And we are here to make the people aware that Gum Health Day, which is celebrated on May 12th every year, is an international awareness day for the people, for the clinicians, for the dental graduates to understand the importance of gum. The gum health, which is important not only for the oral cavity, but also for the overall health. So taking into consideration the overall health, the Gum Health Day is celebrated. Now, we in the research department have done a very fantastic, I should say a fantabulous research activity where we have been working on the digital map. The map is basically focusing on the connection between the periodontal disease and Parkinson's disease. As you all know, that periodontal disease has got a separate entity called as periodontal medicine, where we talk about how the periodontal disease leads to systemic infection. And we have worked on a neurodegenerative disease called as Parkinson's disease, and very privileged to have a design of a digital map, which is available online. And we are happy to present the link for the map where every one of you can go through the link. And we are always open for the further research activity regarding the association of this and looking forward for further more connections, because the gum disease has become very, very prevalent. And in the present scenario, even gum disease and COVID-19 has got a very, very big connection. And we have worked on a research paper for that. And we are looking forward for further research activities in relation to COVID. And maybe in future, we are always welcoming all the young graduates for doing the research activities. The biggest advantage of the activities in our platform is we have a group of lecturers which are not only academicians, but also clinicians. We are balancing the research activities by not only teaching our students in the first year when they are in the award of foundations in dental sciences, the anatomy, the morphology, the histology, the pathology, including the management or the treatment, which can be surgical or non-surgical. So we are treating as a whole. So we make sure that our students come out in such level of intense knowledge that they can have a better face to the other dentists and edge over other dentists, where the management becomes easy with the basic fundamentals of anatomy. So I give the presentation to Professor Romanos, and I think he will address you all regarding all this and the importance of gum health. Professor Romanos, over to you.
Thank you very much, Ashank, Andrea, and everybody. I'm very happy to have part in this group because, as my colleagues said before, we are very focused on this part of dentistry, that is periodontology, because the research, the last research, is always confirming what in Segovia, the European Federation of Periodontology in 2012 defined the connection between the periodontal status and some important, very important health conditions. And among these, the rheumatoid arthritis, and also disease of the heart. And as Ashank is studying the Parkinson's disease, and there is a lot of study all around the world, also about the Alzheimer's disease. There is a very interesting group of colleagues in Birmingham. They are studying this correlation. So we are understanding even more the close relationship between the gums, the perio status, and the health of all our body. So it makes of us some professional that must be very, very focused on the condition of the whole person when we meet him or her in our clinic. So we have a little bit to change our mind, to have a, if I can say, a perio mind. Everybody of us, you are orthodontist, endodontist, prosthetics, it doesn't matter, because we know that the perio diagnosis must be before that every other treatment. This also have some legal consequence. Here in Italy, we have some guidelines of the Ministry of the Health that recalled us this focus. So it's very, very remarkable from the legal point of view and also the clinical point of view. So I'm very happy, and I hope these events can help us to pay more attention and to study and to research, so to can answer to the need of our patients.
Yeah, definitely. As Professor Romanos has already mentioned, there are a lot of studies which are going on, including Alzheimer's disease also. And nowadays, there are a group of authors which are working on rheumatoid arthritis, osteoporosis, which are also the upcoming connections, and definitely the COVID. Now, the only one thing today I would like you all to understand that every year, the European Federation of Periodontology, which is doing a very, very good initiative every year to make the people aware. In 2021, the slogan which EFP has given is "Gum diseases are preventable." This is something which I want all of you to make it very clear, that gum diseases at a stage when they are at gingivitis are preventable, and there are various options of preventing gum disease, which are broadly into two ways. One is, we as patients or most of us have to follow oral hygiene instructions, which are given to you by your periodontist or a dental hygienist, and patient compliance, patient visiting to the dentist at 6 months period or a 3 months period based upon the supportive periodontal therapy. These are the two major aspects which will help you to prevent the gum disease. And this is the slogan given by the EFP for this year. And we all request all the dentists and all the students, upcoming students who are into perio or a general dentist, to make sure that, as my colleague has mentioned, periodontal disease management is the first priority during the dental management. So first, the gums have to be healthy. Then you can look into the various aspects of the dentition, whether you want to go for an implant placement or whether you want to go for a prosthesis. First thing is, the gum health is very, very important and to be considered. The amount of inflammation which is released or which is caused by the gum disease is a prime concern for all the systemic diseases, including COVID, because the coronavirus entry from the nasal or the mouth or the oral cavity is the only two portal of entry into your body, and the saliva contains the virus. That is why we are reinforcing on so much, so that the oral immunity, the oral competency of your mouth has to be so strong, so that the immunity can fight with the virus at the level of an innate immunity, so that we prevent the spread of infection. The infection is spreading especially in most of the parts of the world. I may not say all over globally, but then the extra layers of prevention is important because the virus is multiplying into the cells, especially into your salivary glands, into your gingiva, and into your saliva. So I think for today, we only want you all to be very clear in understanding the importance of gum health, prevention of the gum diseases, and management of the gum diseases, and looking forward for further lot of such educational activities for the maybe for helping all the clinicians available out there across all over the globe. Thank you so much, Professor Mascolo, for giving us.
Thank you very much. Thank you very much, Ashank. Thank you very much, Francesco, because you have touched the most important point, in my opinion, in IMS convention. And our convention, our goal is we would like to create a new methodology of teaching. We are strongly convinced that dentist is not a lifesaver, but the dentist can improve quality of life of patient. I'm very happy because IMS lecturer, IMS researcher are working with student and put student in contact with daily issues. I wanted that student, but not IMS, all lecturer wanted that student become a doctor in the first day of the university experience. They have to feel their profession. I'm sure that this will be the first link, the first spot for future activity. And my suggestion is to improve the contact with student in obtaining the best results. Thank you very much, Ashank. Thank you, Professor Romano.
No problem. Okay, then we conclude the presentation, and any sort of doubts or any sort of queries, it's open platform, and you can mention them in the comment section, and we would be very, very happy and glad to reply you back with the prompt answers. Thank you so much. Thank you very much.